Dr. Christine Horner. If you're perimenopausal, chances are you might be having some uncomfortable symptoms because most women in America do. But actually, those symptoms are things that come from bad choices in diet and lifestyle. So they create imbalances in your body that then show up as these symptoms. So we actually weren't designed to have these symptoms. And in cultures like in India, where they practice traditional systems of medicine like Ayurveda, women don't have the kinds of symptoms that they have here in the United States. Now again, most of these things stem from diet and lifestyle issues. So when you clean up your diet and live a much healthier lifestyle, getting plenty of exercise, going to bed by 10 o'clock, then a lot of times these symptoms will go away. Now the ones that persist, then sometimes it's good to look into using some herbs that can help to eliminate some of the symptoms, and there's a number of ones that are good for hot flashes. But one of the most uncomfortable symptoms that people have to deal with is vaginal dryness or vaginal atrophy. And that can be a little trickier and doesn't respond to herbs quite as well as some of the other symptoms that you get with menopause. Now, a lot of times women want to turn to using estrogen type creams to help to alleviate their symptoms, but they're not always safe because they actually get absorbed into your system, and higher levels of estrogen are something that can increase your risk of various different types of cancer, including breast cancer and potentially endometrial cancer too. So there are some natural products that you can use, and one in particular is made from a plant that's from the daisy family, and it's called calendula, and it's been used for thousands of years by traditional systems of medicine primarily for wound healing, and lots of research on it showing that it's good for various different skin conditions, anti-aging, it's antiviral, it's antibacterial, and also helps in the anti-aging field as far as helping to thicken the skin. So there's a product called Vagical, which is made from calendula, and it is applied topically, and preliminary studies show that it's got some really good response with it. So I would recommend trying to use something natural rather than pharmaceutical because it's a lot safer. And again, doing the diet and lifestyle changes are extremely important because nothing works very well if you're still doing the things that are creating your symptoms.